Hi, good afternoon, everyone. Thank you for joining us for our Ochsner Health Talent Talk series, where we connect you with leaders across the system to share a little bit more about their great work with Ochsner Health and how you can join our team. I'm very excited to be your host today. My name is Morgan Valvo. I am one of our talent acquisition managers that oversee the career outreach and university relations team, and I'm happy to bring you this fabulous panel of great leaders from our system to talk a little bit more about our newest Ochsner Community Health Free Family Center, which is opening in the North Baton Rouge region very shortly. So before we get started today, I do want to point out that this webinar is part of a two-part series that we have for this new Community Health Family Center, where we will have the talent talk, where we're going to talk a little bit more about the great work and how you can get involved if you live in the Baton Rouge region, as well as just career opportunities for Baton Rouge residents that want to join the Ochsner team. We'll also be following up with a virtual career fair, which will take place Tuesday, April 13th, where you can join and chat live with some of our talent acquisition representatives to learn more about career opportunities and how you can apply. So to kick off our panel today, I would like to have all of our panelists do a quick little introduction and tell us a little bit more about yourself. And I'd like to have Kevin go first.
Well, good afternoon, everyone. Again, thanks for joining. My name is Kevin Green. I am currently the Vice President of our Community Health Center initiative here with Ochsner Health. I have been in healthcare roughly 7 years, but have been working professionally with the military, et cetera, for roughly 24 now. I am a Louisiana resident. I have been born and raised in Louisiana, from New Orleans, graduated from LSU, and to be not only a part of, but to be leading this initiative with Dr. Robinson and others is truly an honor. And I look forward to collaborating across the state and working together and accomplishing the goals that we've set.
Thank you, Kevin. Scott, you want to go ahead and introduce yourself next?
Thanks. Good afternoon, everyone. I'm Scott Mabry. I'm the Chief Operating Officer for Ochsner, Baton Rouge. I was born in Baton Rouge. I grew up in Louisiana. After several years in my career, I moved back to Baton Rouge 7 years ago, and love being back with my family and my wife and my kids, and very excited about the future of Ochsner and Baton Rouge.
Thank you. Dr. Robinson, you want to go ahead and introduce yourself next?
Sure. My name is Wanda Robinson. I'm a family medicine physician by training. I've been with Ochsner for the past 23 years. I am practicing on the West Bank side of New Orleans, where I was born and raised. And I currently serve as the medical director for the Community Health Center. And I'm looking forward to partnering with Baton Rouge.
Thank you. Dr. Bagwu, you want to go ahead and go next?
Hi, everyone. Good to see you. You're welcome. I'm Dr. Edith Valvo, and I'm the primary physician for the new Baton Rouge Community Health Center that's coming up. I have been in healthcare for 20 years, but I've only been with Ochsner for 3.5 years. In that 3.5 years, I spent most of my time in Denham Springs area, taking care of patients, providing preventive and health maintenance care. I'm also a member of the Ochsner Ambassador team. I'm a senior lecturer with Ochsner affiliated University of Queensland. So I do see and mentor a lot of fourth-year medical students on their rural rotations. So far, it has been a great journey, and I'm looking forward to the Community Health Center.
Yes, thank you so much for joining us. We appreciate it. Shannon, you want to go ahead and introduce yourself?
Sure. Hi, everyone. Good to see you guys. My name is Shannon Joseph. I am Director of Workforce Development for the system here at Ochsner. I've been in workforce development probably for the last 10 years and have been with Ochsner for the last 2.5 years. I'm excited about the work that is happening in Baton Rouge and very excited to see what the work looks like for the Community Health Center. So pleasure to be here. Thank you.
Yes, thank you so much, Shannon. Also a vet of our Talent Talk series. Shannon's been on several of these. We always appreciate her joining us. And next, I would like to have Matt. You want to go ahead and introduce yourself?
Sure thing, Morgan. Good afternoon, everyone. My name is Matt, and I work with Morgan in the Human Resources Department, and currently have the privilege of working in the Baton Rouge area and hiring many wonderful, talented people. So it's a very exciting job, and can't wait to explore more with you as far as our opportunities go.
Thank you, Matt. And I just want to share for everyone that's joining us, whether it is through the Zoom webinar or if you're joining us live on our Facebook page. If you'd like to submit questions, if we have time at the end, we will answer some live. Or if we don't have time, we'll follow up via email for all questions. And if you're on the Zoom webinar, you can use the Q&A feature that's at the bottom of the screen to submit questions. So kind of kick us off today, I really want to start with you, Kevin. I know you and your team are working to open community health centers across the state, and it's just really critical and important work here at Ochsner Health. I would love if you could share a little bit more about the goals associated with the community health centers and kind of your strategy with their opening.
Sure, of course. I'd like to start with saying why we're doing this work. And the primary driver behind Ochsner moving into the community health space is because it's absolutely necessary. It's not that there are not others and other organizations, very good organizations out here in the community health center space, but the resources that we have as a system, whether they be through innovative technologies, access, specialty services, our ability to collaborate across the state with such a well-formed integrated network, it's essential to meeting our success, to our goals. And what our goal is to no longer be 50th and 14 of the last 21 years, we've been either 49th or 50th as a state. That is a fact. That's national ranking by health outcomes. And our goal is to change that, to change the quality of life for our citizens in Louisiana, our patients, our family, our friends. And for me, particularly, it's a very personal thing. It truly is, because our work, my leadership style has always been as a servant. I've been in the military for years, and I came to healthcare because it allows me to continue to serve other people. And working in the community health centers feels even more deeply within my purpose, I would say. So our plan and how we intend to do this, to answer your question finally, right, it is to open 15 sites across the state in areas such as Shreveport, Lake Charles, Lafayette, quite a few in the greater New Orleans area, whether it be Jefferson Parish, Metairie, North Shore, even out to areas such as Buckaloosa. There'll be at least 15 over the next 3 years. And to do that, we're hiring physicians, we're hiring community health workers, we're hiring those that not only work in the clinical space, but also in the social space to accomplish this goal. And the way that I believe that we can accomplish this is to work strategically, as in building trust, as in developing collaborative partnerships, and to create access. 85% of patients in Louisiana do not have suitable access to primary care. Our challenge is to solve that problem.
Yes, and thank you. And I think you really spoke to the great work that the system is doing to improve health across the state of Louisiana, and I'm so grateful for that. I want to talk a little bit more about access to care that you touched on. Dr. Robinson, can you share more about the care that's going to be provided at this new clinic site, and when patients can expect to be able to access that care?
Absolutely. First and foremost, I want to echo Kevin that we're so excited to partner with the North Baton Rouge community to increase access of medical care. We're happy to announce Howell Place will be opening exactly 1 week from today on April 8th. We will provide traditional medical services in adult, primary care, pediatrics, OBGYN. We would perform routine screenings for cancer, treat chronic conditions such as hypertension and diabetes, as you would see in other primary care clinics, but we'll have additional services to help our patients achieve their health goals. We'll have a clinical social worker, as well as a smoking cessation counselor. When we open the doors in the future, we plan to bring on other specialties such as endocrine, so we can provide diabetes education for our patients. And we've also been in discussions with our hematology department, who wants to partner with us in treating patients with sickle cell disease, which we know is very prevalent in the African American community. So we have plans also to address a lot of the social determinants of health in this community as well. We know that 10% of a person's outcome is medical, but 90% is determined by their environment, whether social, genetics, environmental. So we are excited to have community health workers that will help patients to improve those areas as well. So we're very excited to be joining the community.
Yes, absolutely. And I think, all the things you spoke to, especially social determinants of health, one of the really exciting things about these health centers as they open, so not just addressing the patient needs, but also removing barriers and being able to provide access for total wellness. I think that's an excellent point. And now I want to turn it over to Scott to talk a little bit more about how this community health center will work with all of our locations in the Baton Rouge region.
Yeah, Morgan, thank you. As you know, one of the strategies at Ochsner is to bring care closer to our patients. And this community health center helps us further that strategy in the Baton Rouge region. Today, we have over 15 health centers from Iberville to Hammond, Gonzales up to Zachary. And now this will be another access point for patients and communities in this area. One of the biggest advantages of this health center, as well as our others, is they're all in the same electronic medical record. So in addition to the services that Wanda just mentioned, if a patient needs a referral to a specialist or needs to be admitted to a higher level of care at one of our hospitals or therapy or one of those other services, that medical record is able to be seen by any provider across the entire network, which spans the state of Louisiana and into Mississippi as well. We aim to provide seamless care for these patients wherever they enter one of our health centers.
Actually, Morgan, before you, if you're done, Scott, Morgan, before you go on, could I interject?
Yeah, absolutely.
Okay. All right. Well, to add to Scott's points, we will absolutely work within our organization in such a integrated way and ensuring that we leverage the resources internally. But I just wanted to add that we're also working externally to partner with, we are a community health center, but we are not an FQHC, and we won't be an FQHC, but we will partner with the FQHCs in your community and within other communities to ensure that we have a really, truly comprehensive product and offering for those in the North Baton Rouge area. And as I say partner, there are services such as dental, there's broader support in the primary care space, there's opportunity for us to partner with Southern University and other areas. As a matter of fact, on April 28th, just to say hello to the community and neighborhood, we're going to have a beautification day where we're going out and we're just kind of cleaning up and just being a part of the area. We want everyone to understand that we are here as community members. Our employees will be community members. We are of the community. We represent the community, and that's in every aspect. Not only in our cultural and our clinical understanding of who we are as people from Louisiana, but also in our willingness to roll up our sleeves and do the work with everyone.
Thank you, Kevin and Scott. I think that y'all shared such great information. I'm excited to hear more about the Beautification Day. It's so great to see us continuing to give back to the community in communities in which we serve. So I'm very excited for that. I now want to turn it over to Dr. Bagru to talk a little bit more about what specifically is going to make this facility special for providers and the patients that they serve.
So this community health center is strategically located to serve a greater Baton Rouge and surrounding cities. But what really makes the clinic special is how we're doing it. We're bringing in a team of trained professionals to an area where it's most needed. We will be providing preventive care, health maintenance. We'll be providing care for chronic illnesses. We'll also be treating acute illnesses. We will have pediatrics, OB, we will have social worker. And we know that, given my background coming from a third world country, we know that where people live, work, and also where they raise their children determines how far they can go in their health. So by redirecting healthcare to where it's most needed. We're trying to improve not just a small area of Baton Rouge, but the whole Louisiana. I've been in healthcare, I have experience, I have patients, I love the relationship I have with my patients, and that's what I hope to bring to this community. I see generations in my clinic, and I will continue to do that. I have I'm very passionate about teaching my patients because I've seen what can happen when people don't understand what's going on. My goal is to focus on reducing health risks and also improving health outcomes in our greater Baton Rouge area and Louisiana. Ochsner has done a marvelous thing, which is giving us this opportunity, and we're just grabbing it and running with it. And I hope that when people come, they will leave knowing that they got the best care that they deserve. And that's what we're doing. That's what's going to make us special. In this clinic, we will have on-site lab, we will have x-rays, we will have ultrasound, we will have point of care testing, we will have social worker, we will have all the collaborations from specialties, which is what Ochsner is known for. Ochsner has specialties to back us up. And we have everything, and we're bringing it into this community, and we're hoping that people will just take advantage of what Ochsner is providing so that we can make our state greater and look better.
Yes, thank you. And it's great to hear the provider perspective in terms of all the resources allotted to you at a community health center like this. So thank you for sharing. I appreciate it. For this next question, I think we'd be remiss if we didn't talk a little bit about COVID vaccinations across the state and some of the great work that Ochsner Health is doing to get our population vaccinated. Dr. Robinson, can you speak a little bit more about our approach to vaccination and how this health center will be a part of that?
So Ochsner has a system task force, but within that task force, we have developed what we call the Equitable Vaccine Task Force, and that's to address patients who may have disparities and may not have access to vaccines due to multiple reasons. We have allocated a certain number of vaccines for certain regions and certain populations. We've partnered with local churches, community health centers, senior centers, in different regions to make sure that we can get the vaccines to those that are in the most critical need of the vaccines and who are being affected the most adversely from this disease. So we are bringing the vaccines to where people work, live, and play, and we are getting rid of those barriers such as transportation. We are also allowing for folks to walk up and register on site, for those who may not be tech savvy or just to know how to navigate some of the IT platforms to sign up for the vaccines. And we've seen that work really well in other regions in New Orleans East. We've had very good success working with one of the local churches there and at our own community health center in New Orleans East. And so we found that to be a very successful platform to get the vaccine to those communities that are underserved. And we hope to do the same thing at Howell Place as well in the future. We would like that to be designated as a vaccine distribution site as well. So I would say that Ochsner is very much doing its part to make sure that we are addressing different groups and to make sure that we're being fair as we distribute these vaccines and get it to the people who really need it the most.
Thank you.
Morgan, if I may add to Wanda's comments, a lot of that work has already begun. We've had several community vaccine events in North Baton Rouge and the surrounding areas. Just this past Saturday, we had a mass vaccine event at Southern University, which is about a mile from Howell Place. We had 2,000 doses to administer. We had over 800 people show up and receive their first dose vaccine. And to Wanda's point about transportation, I helped direct traffic as they were coming in. I saw a taxi cab full of 4 or 5 people pull in there. We had several people walk up, even though it was a drive-through, and I even saw a couple of gentlemen on bikes come through. There are more events. There are more community vaccine events coming up. Be happy to share that information with the group afterwards so that we can post it and so that people know where they can go, when they can go to start getting their first doses.
Yes, absolutely. Thank you, Scott. And it's incredible work that we're seeing done. I've been able to volunteer at the vaccination sites myself here in New Orleans, and it's just really, it's so meaningful. And it's great to be able to give access to our community members. So I love to hear this. So thank you, guys. I want to go back to you, Dr. Valvo, and talk a little bit about your passion for this work. So when you and I chatted briefly before this, you told me how excited you were about the opportunity to be able to work at this community health center and how you knew that you wanted to get in there and be able to start providing care to patients within this community. So you want to share a little bit more?
Sure, thank you for that question. When I heard that Ochsner was opening up a community health center, I was thrilled. You could say from my background coming from a third world country, I have seen firsthand what can happen when people don't have access to healthcare. I have seen people die from massive heart attack. I never knew they had hypertension. I have seen people diagnosed with end-stage renal disease. I never knew that they were diabetic. In fact, that was why I chose to go to med school. My passion is to get the education I need and be able to teach my people how to take care of themselves and stop dying for no reason. I've seen moms live in fear because they know if their child ever gets sick, they don't have anywhere of getting to a trained medical provider. So when I heard that Ochsner is actually bringing professionals into a community where these things are needed, I was very much interested. I quickly signed on to it. It's my passion. I love to teach my patients. I believe that knowledge is power. And I believe that when you have that knowledge, when you understand what's going on in your body, you can better take care of yourself. I devote a lot of my time to teaching, and that's why I mentor students too, because I believe that I could share my knowledge with them. When I go into the community health center, I will still continue to be an advocate for my patients. I'll continue to teach them. I'll continue to help them set their healthcare goals. I will advocate. We have the social worker that will help us to cut down on the barriers to access and help patients meet their goals. I was really, really excited, and I'm looking forward to it. And it's going to be a good venture.
Yes, I am so excited for you. Yes, go ahead, Kevin.
Morgan, I just wanted to add to Dr. Valvo's comment around her passion and what, how she sees supporting these patients. I think it's important to note this, that Ochsner has, we've taken care of patients all throughout the state, absolutely. But I want to note specifically with these community health centers that we're working to move clinical as well as social barriers. And we're working to remove things such as transportation barriers, but we're also removing financial barriers. So for all patients, regardless of ability to pay, I want that to be very clear that this is your community health center. We're here to care for you. So come to us. That is not a barrier that you have with these health centers. So whether you're able to pay or not, you come to your How Play site, and we're here to care for you. I just really wanted to be very clear about that.
Yeah, thank you, Kevin. And that's an excellent point. Both you and Dr. Valvo, it's very clear that you're passionate about this work. And I'm very excited to see the impact that y'all are going to have on this community in North Baton Rouge. It's really exciting. I want to kind of talk a little bit more, though, about the Baton Rouge area as a whole. We've seen some exciting growth development plans over the past few years, and with the opening of the Grove, the expansion of the Cancer Center, and now with this Community Health Center. Scott, can you share a little bit more about some of the future growth plans that y'all have for the Baton Rouge region?
Yes, Morgan, absolutely. It feels like it never slows down. We talked about access points earlier. We have several additional urgent care locations in development in Baton Rouge and Livingston Parish as well. We have expansions on our hospital campus and our MOB, as well as our cancer center. We have a brand new facility that we have broken ground on in Gonzales as well. We recently added about 12,000 square feet in Prairieville. We had a new health center open up on Bluebonnet just earlier or at the end of last year. And so there is always opportunities to create more access. Again, our strategy is to bring care closer to the patients for their convenience. And so those are just some of the developments that we have in the works today.
Very exciting. Definitely very exciting to see. And y'all are not busy at all in Baton Rouge, right? The team is not busy at all. So now I want to turn it over to Matt to talk a little bit more about career opportunities. We know with the opening of this community health center and the growth, it brings lots of career ventures for those interested in seeking a career with Ochsner Health. Can you share a little bit more about the current opportunities we have available for those interested?
Absolutely. I mean, you heard it from Scott. Everything is just expanding rapidly right now in Baton Rouge. We have ample opportunities across the board open, ranging from RNs, LPNs, medical assistants. We have a need for patient care techs right now. The lab, every position in the lab we're hiring for right now. You name it, and we're hiring right now for it. For the clinics, we're mainly looking for LPNs, medical assistants, and for our hospitals, just everything, the lab, RNs, all the above. If you are interested though in working with us, just feel free to Google Ochsner Careers. It'll take you right to our careers page. You can become familiar with it and just create a profile and reach out to us, and we'll be happy to speak with you.
I'd like to have another addition. And I'd like to add that if you are specifically interested in our community health centers, in addition to our Health Place site, we have a site in Sherwood. Our Health Place site is going to have roughly 19 team members between the physicians and the staff members. Health Place, as far as the staff, will have approximately double the staff in Sherwood. So if you're interested, now Sherwood won't open until Q3 of 2022, but just know that if you're interested in community health centers, there is another coming, and there'll be lots of opportunities to join the Ochsner team there.
Kevin, that was on my list too, but I wanted to save the grand announcement for you.
Oh, well, thank you. I appreciate that.
Yes, thank you for sharing that, Kevin. I think that's super exciting, and it's great to be able to see the impact that we're going to have now with Health Place and then the growth with the Sherwood location next year. And it'll be here before you know it. So if you're interested, make sure that you keep up with us on the opening of that site. And I appreciate you sharing a little bit about the areas of opportunity, Matt, for those interested in looking for jobs within the Baton Rouge region at Ochsner Health. And now I want to turn over to Shannon. Shannon, as you know, leads our workforce development team and some of the great programming that we do across the state. So Shannon, can you share a little bit more about the programming that you're going to be offering to community members looking to get started with a career in healthcare?
Absolutely. So thank you for that, Morgan. And for some of you who are familiar with workforce, forgive me for teaching you something or giving you some information that you already know. But I want to share with you guys that our workforce development programs here at Ochsner are focused on our allied health positions within the organization. These positions can be anywhere from a medical assistant, a patient access rep. Those are going to be those individuals who are registering you when you enter into the clinics or the hospitals, as well as highly skilled allied health positions such as our medical lab technicians, LPNs, as well as medical coders and billers. Those are some of the programs that we currently offer, plus some others that we are venturing out into as well. Our programs are absolutely designed not only to educate individuals, but to also train them in a way that we can also place them at the end of their training. Our folks are walking away with industry-based credentials, IBCs. Those IBCs are an opportunity for them to not only work within their chosen career here with us at Ochsner, but they're also nationally recognized, thereby making them transportable. These are certifications and licenses that you can go anywhere in the United States and be able to serve in the same capacity. So we're very excited about that, building a robust workforce, not only for our organization, but absolutely for the communities in which we live as well. And of course, you know, we would want for everyone that goes through our training programs to stay with Ochsner. That is our goal in all that we do. These programs are absolutely debt-free. They're cost-free opportunities for individuals to receive stellar education and training, as well as job placement. So it's a very exciting time for us. We're excited about the movement, excited about the things that we will be doing in Baton Rouge, and more excited about those individuals who we can bring into our Ochsner family. So Morgan, I hope that answers your question.
Yes, absolutely. I'm always so impressed by the work of your team. I think one of the biggest benefits of training programs is that it's no cost to participants, and they're able to leave with skills that they can utilize for the remainder of their career. So really just enhancing their livelihood through your programming. I know you also offer some additional benefits for participants. Would you like to share some of those now?
Absolutely. Each of our programs include what we call wraparound services. Those services address barriers to employment, as well as those barriers to maintaining employment. Kevin spoke earlier about opportunities for transportation for patients to get to and fro. We also ensure that there's transportation available for our students within our cohorts. We all know there's life happens. Let's just be plain about it. Life happens. So we work to ensure that we have navigation opportunities for those things that occur. Along with those pieces such as transportation assistance, childcare assistance, we also have built in a mechanism to ensure that all of your books are paid for, your uniforms are paid for. So when we speak about a cost-free opportunity, it is absolutely that. We built in a social worker as well within these training programs to help meet those barriers as well. Again, there are challenges that come about that folks need help in navigating. The goal is to ensure that you are successful in these training programs. So we will offer a comprehensive approach to ensuring that success. Our participants will enter into a cohort. Those cohorts are typically somewhere between 15 and 20 individuals. We find that that model works successfully for us for a couple of reasons. When you're in a cohort, you have a bond with those individuals who you are working towards the same goal with. When we were in high school or college or whatever educational opportunity, it was all about having a buddy. That's what that individual serves as. So you've got 15, 20 buddies in your program to help push you and get you through your programming. And then we also find that the cohort mechanism works well even after those individuals have completed the training program. Just think, you're on your first day, you've been onboarded, and now you're ready to go to work, and I'm frozen. I don't know what to do. I've got someone who I already know within the organization that's doing the same work. I can call them, I can rely on them because I've built that relationship, I've built the trust, and it enables you to be successful on the job as well. So we're excited about those incentives that we offer to individuals who come through our workforce development programs as well. And there's opportunity for those same folks, you guys, to be able to progress through pathways of employment as well. You may enter in as a medical assistant, and by the time you finished your career, you're an RN because you've gone through additional training opportunity that's been afforded to you through the organization. Again, cost-free. Can you imagine that? Coming in and now you're finished with your nursing career and from where you started. So there is a plethora of opportunity within workforce development, within Ochsner, within our system. So I'm excited about being able to share that with you guys soon.
Yes, thank you so much, Shannon. And I love just hearing about the work. I think there's some common themes here about removing barriers and making sure that the individual is able to be successful in the workforce development program. And I love to hear it. I love the cohort environment, how you're setting them up for success in their future career. Can you share with us what would be the first step in getting involved in some of these programs, as well as maybe some of the cohorts that you're going to have starting soon in the Baton Rouge region?
Absolutely. So just to name a few of the programs we will be starting very soon. One we hope to be recruiting for within the next 4 weeks would be a patient care technician, which is an entry-level frontline clinical position within the organization. We'll also be recruiting for a pharmacy tech registered apprenticeship in the Baton Rouge area as well, along with a program that we are actually teaming up in resources and leveraging relationships and the like with Our Lady. Kevin spoke earlier about us being your community partner. We are absolutely just that. We are committed to ensuring that we present a robust opportunity for individuals. That partnering with Our Lady will look like a surgical tech opportunity, something that some folks have no idea what it is, but we'd love to give you an opportunity to learn more about it. And to do that, we will be hosting additional forums just as this one, talent talks, that will speak to when registration for the talent talk happens. There'll also be opportunities to understand when we will start with accepting applications and partnering with Matthew and TA, along with what the whole process looks like, the interview process, what happens for my first day of class. All of those pieces would be talked about in discussion and conversation during our talent talk for those programs. So I'll ask you guys to be sure to look out for externally. We promote on Facebook, LinkedIn, Instagram as well. We partner with Morgan and her team, getting the word out to you guys, and as well as on our Ochsner website. And if you just are dying to get in touch with us right now to find out what's happening and to be placed in the loop, please email us at workforce@ochsner.org. We are more than excited about answering those questions you guys might have to talk about opportunities within the Community Health Center, as well as those opportunities that exist in the Baton Rouge area within our hospitals as well. So we're looking forward to speaking more with you guys.
Yes, thank you, Shannon. And as Shannon mentioned, once we open up the cohorts, we will be doing a talent talk to talk more about what interested applicants should do in terms of their next steps. So the best way to hear about our talent talk series is through our careers Facebook page, so Careers at Ochsner Health on Facebook. Just go ahead and subscribe if you're not, so we get all of those notifications. And this has been such a great panel, and I love hearing about all of the great work that's going on. Just to kind of close this out, Matt, would you want to talk a little bit more about next steps for interested applicants?
Sure thing, Morgan. So if you think you really may be interested in coming to work with us and want to learn some more information, then please join us for our virtual career event we're going to have on Tuesday, April 13th. Everyone that signed up for this webinar should receive an email shortly afterward. It'll have all the details in it. If you are interested, feel free to sign up and join us. I believe they're going to post the link here down at the bottom in just a minute so you can see. Is that correct, Morgan?
Yes, we're going to put the link in the chat.
Okay.
And Caitlin's sharing her screen with the information as well.
Very good. But anyway, we certainly hope to hear from you.
Yes, absolutely. So as Matt said, if you're registered for the webinar, you'll get an email about the virtual career event. You can also find information on our careers Facebook page. And then Caitlin, if you're on the live session, is going to drop it in the chat for you guys. You can just click right there to register. It's going to be a great event where we're going to have talent acquisition representatives speaking to all opportunities in the Baton Rouge region. So I just want to thank our panel. You guys have been great and been able to give lots of great information about the new Howell Place Community Health Center that's opening. We're super excited for next Thursday. I'm going to ask all the panelists to stay on since we do have a few minutes to see if we get any questions from the chat that we can answer live. So if you're tuning in and you have a question, go ahead and submit it through the Q&A feature at the bottom of your screen, and we'll just take a few minutes. And so I'll go ahead and answer the first one in the chat. Thanks for submitting this question about putting in applications and being a part of our team. I definitely encourage you to join our virtual career event on April 13th. That's a great way to talk to several different individuals from the TA team about current opportunities and what we have open. You can also go through our career site and chat with us there and submit your application for interested jobs. But I think the virtual event will give you direct access to talk about what we have open and what would be the best fit for your qualifications. I hope that answered your question. And then we do have another question. And I would say, Kevin or Dr. Robinson, maybe you'd be able to answer this question. Speaking about the new facility, the Howell Community Place Center, will there be pharmacy services there and pharmacy-related jobs open for that location?
So at Howell Place, we do not have plans to incorporate pharmacy in the clinic because of the space constraints. So we are considering pharmacy at some of our other locations, where we have a larger space. I'm not completely sure about Sherwood. Kevin, is this the one?
Yeah. The current Sherwood space does not have current programming for pharmacy. Yeah, we're continually assessing needs in the area. And as we review the data, if there is a need to incorporate pharmacy, then we'll have those discussions, because the point in all of this is to ensure that the right services are there for the patients as they need them. That's why we have imaging in Howell Place yet, but not pharmacy, unfortunately. But there are now, from a patient perspective, there will be ways in which we can help you to access your pharmacy needs. But from a staffing perspective at Howell Place, there's no current plan to have pharmacy in Sherwood. It is yet to be determined, but not currently.
Thank you. No, thank you for that. I can say that I know we have pharmacy tech opportunities and pharmacy opportunities across the Baton Rouge region at several other locations if you're interested. So definitely encourage you to check there and join our virtual career chat. And we will have our recruiters that are focused on the allied health service lines there to talk about what's currently open and how they can connect you with a hiring manager. And then I see one other question. I think this would be great for you to answer, Shannon. So what is the average amount of time to complete the program for workforce development, such as patient care tech or pharmacy tech?
Absolutely. So with the patient care technician piece, the normal time for that is about 8 weeks. So you will leave with 2 IBCs in the patient care technician. You'll have a patient care technician certification as well as your CNA, which will enable you to be able to work anywhere that patient care technicians are needed within the system, including our skilled nursing opportunities as well. As it relates to the pharmacy tech piece, that's a little bit longer. So pharmacy tech is a registered apprenticeship. So it is 2,000 hours, which equates to about a year. You will have didactic presentation, which is your education piece, for 6 months. After that 6 months, you'll then move into on-the-job training, where you will put those things that you've learned into application, but you will complete that program as well as a licensed pharmacy technician too, which will give you the opportunity to also enter into a more structured and advanced opportunity to eventually get into a pharmacy tech 4, which will enable you to be able to process drugs that are a bit more complex than the ones that you will start with as a pharmacy tech 2, those things including chemotherapy drugs and the like. So it is an opportunity to come into a position at an entry-level place of Pharm Tech 2 and finishing in a Pharm Tech 4. So it's a great opportunity for individuals who are looking to do that.
Thank you, Shannon. I appreciate that. And then I see one more question I think would be great for you to answer, Scott. Are there any upcoming mass vaccination events for the Baton Rouge area within the next month?
Mass vaccine, so the next mass vaccine will likely be the second dose for this past weekend. So another 3 or 4 weeks will be at Southern again. There are some smaller community vaccine events. I will email those to you. Actually, I have some in front of me. So on April 6th, there will be an event at the Breck Park on Alaska Street. On April 16th, there will be an event at the YMCA Pennington. And then on the 17th, there'll be an event at the Vietnamese Hope Church. If anybody wants to schedule an appointment, the number to call is 844-888-2772. 844-888-2772. They will direct you to the nearest event that meets your needs, first or second dose.
Thank you. We definitely appreciate that. And we're very excited to see you guys go into the community and offer vaccinations for our community members. And then we have one more question actually, and since we have some time, I think we should answer it. So this again would be for you, Shannon. How about training for patient access reps? Is that on the job training?
So the patient access rep is actually wrapped into our medical assistant program. When we train, we like to make sure that we're cross-training individuals. So our medical assistant training, you will end with a CCMA, Certified Clinical Medical Assistant, which will address both the administrative as well as the clinical side of the house. You'll also leave with additional IBCs as a phlebotomist. You'll receive a CNA, as well as you will also get an EKG certification wrapped into that particular training as well. It has been very beneficial for us. The business case for it was proven during COVID. We actually had a class in Baton Rouge that graduated on March 12th, and the world shut down on March 16th. So we were not exactly sure what those individuals would be able to do as medical assistants, being that some of our clinics were closing and the like, just a lot of things up in the air. But those medical assistants were able to move into phlebotomy roles where we needed them. They were also able to move into PCT roles. So we were able to hold on to these individuals to ensure that they maintain their employment, especially based on working for 8 whole months to get these certifications. We wanted to ensure that we held our end of the deal and held to our commitment to make sure that they would be employed within our organization. And they have served us very well. They are still employed, and we are very excited about the work that they are doing and the work that they will continue to do.
Yes, thank you. Thanks for that, Shannon. And I do think that is just one of the most incredible things I was able to see here at Ochsner last year at the onset of the pandemic, ensuring that all of our employees had the ability to work and care for their families during the time of need, even if their original clinic site had to be closed due to quarantining. So it's just been one of the most rewarding things I've definitely seen here. So I appreciate you speaking to that. I see a few other comments, and I just want to say thank you everyone for sending your comments, letting us know that you're excited about the virtual event or that you're interested in the job with us. We'll be following up with you after this live session via email to give you more information on how you can connect and kind of help you navigate the job process here at Ochsner. Because we know that oftentimes we are such a large organization, there's lots of opportunities. Again, I just want to thank our panelists. It's been great to connect with you guys and hear a little bit more about the work that you're doing. And we hope that everyone on the call is going to join us for our virtual event, which will, again, I'm plug it one more time, taking place Tuesday, April 13th from 11 a.m. to 1 p.m. And to register, you can check out our career site. You can also check out our Facebook page. We'll have links, and then we'll also be emailing it out. So lots of ways to get signed up to participate. I just want to thank you, everyone, and I hope you guys have a great evening.